famous foam roller, as you know, it's usually round, but this particular one is a half a foam roller, and it's short for a reason, so it's very easy to use, and you can travel with it, put it in your knapsack. It's amazing the things you can do with this, and I'll demonstrate a few exercises. This is sold at Cool East Market. So basically, we're going to start with the lower body and move up the chain towards the lower back. I'm going to start with the calf muscle. What you do is place the Achilles tendon. So that's the strongest tendon of the human body. And if the weight is not enough, you don't feel anything there, you just place the other leg on top of it. And if you're still not getting enough weight, you can lift your upper body, your bum off. And basically you want to move in a lateral fashion. So my foot is moving left and right. So I'm massaging the tendon, bringing blood flow and nutrients into the area. This is especially good after a workout. You don't have to do it exactly right after the workout. You can do it like hours later. It's all good. And once you finish at one spot, I call them passes, so 5 passes each way. Then I move down a bit further. And to keep it simple, I usually go 5 by 5. So I do 5 spots along the way, all the way up close to the back of the knee joint. A lot of people tend to be quite tender just where the calf muscle comes and attaches with the hamstring, that area there, so be careful. And you just roll it left to right. Now, another thing that you have trigger points in muscles, and let's say for example, I feel a tender spot there. I can just hold it, allow the blood flow to come in, and just hold it for about 30 seconds and then start to move it slowly. Okay. For the shin muscle, I would imagine that many of you like to do a lot of walking and jogging and running. So the shin muscle is crucial for lifting your foot like that. That's called a dorsiflexion. So when you're running and you lift your foot up, that's why we wear these flat shoes, right? So we don't have to lift as high. Alright, so if you have a shoe that has a fairly high heel, then you have to dorsiflex further, and it's going to create much more tension in this area. And it's going to be much more sustained, so your foot action is going to be slower. So basically, when you're moving, this foot needs to be up like that, and then you want to land around the middle to your forefoot. Now, this is not a running coaching program, but just the idea of understanding that when you land with these flat shoes, you want to land your forefoot to midfoot area, and that's basically how you want to do it. Now, for the shin area, I'm going to start with the upper shin here, just below my knee joint. So we typically don't pay attention to the lower half of the knee joint. The lower half of the knee joint has to do with these 2 bones here. You have 2 bones, just like your upper body. You have 2 bones there on the forearms. You have 2 bones here. That's called your fibula and tibia. So I'm going to put pressure on that, and I can put my other leg on top, and I can just start to move my hip left to right. Then I move down a bit further. So 5 passes and 5 spots along the way. If I find a spot that feels a bit tender, it's going to hold it there for a bit. I just found a spot. And basically that's how it's done. Moving to the hamstrings. Same idea. I just put the weight there, the hamstring, and I just roll left to right. Now, some of you may not feel much here, but things are happening. Things are happening. And if you don't feel very tender, that's where the tune-up ball is going to come in. The tune-up ball is going to be coming to a smaller spot on your muscles, and it's going to go deeper. And then hopefully your brain can allow you to absorb it. So we're going to go through that in a moment. So basically, that's the idea. Like that, I just roll. So the side of this area we call the IT band attaches down here all the way up into the hip. We do not, the IT band, the fibers runs this way, and you want to open the fibers this way. But the IT band is a band, it's not a muscle. So there's a big muscle, behind it, and that's your quad muscle, the lateral quad muscle. And I'm going to go not directly on the side like this. I'm going to roll a bit more anterior, right? I'm going to roll a bit more anterior like that. I'm going to come on my elbow. I'm going to find a spot where I feel a little bit of a tension. This foot is going to help me to take some weight off. If I can get more weight on there, I just go like this. Okay? From here, this is how I like to do it. I'm going to bend my knee. So I'm starting to stretch out that muscle a tiny bit and work it. So I'm bringing blood flow into the area. And then I just do the 5 reps, move down, all the way towards my hip. And that's how I would do the lateral quad. Don't think of it as much as the IT band, think more of a lateral quad release. Then from there, face down, just above my knee joint, and relax, and move the joint. I'm going to lengthen your quad. I'm just going to get to the middle of the rectus femoris muscle, which is the middle quad muscle, along with the muscle that's on both sides of it. Move down, 5 passes, and so on. For the glutes, just going to basically create a figure 4, like that. Turn to the side, where the joint opens up, and you start to move back and forth like this. Again, if you find a spot that feels really tight, just hold it for a moment and pause there. Sometimes I also sit right in the middle, so the glute muscle comes into this bone in the middle, right? That's the base of your spine. Okay, so the coccyx bone. And I just sit there and I just allow that firmware to absorb, and it's releasing. A lot of us tend to be tight there, but we don't realize it. We're focusing so much on the lateral sides all the time. But if you can release that area, that's where some of the major small muscles in the glutes. You have 9 glute muscles, so not just the big glutes max. You have 8 more. Okay, so they all have to communicate and work together. I can also rock my knees left to right, again to bring circulation and nutrients into the area. And that's how I would generally use this foam roller. And the final part would be my lower back. So I will bend my knees, hands behind the head. I'll do like an ab curl. Take it back, release, let the pelvis relax. You can bring one leg up like this, because lower back and lower back pain has a lot to do with the hip and the pelvis position. So as you move one leg up, you'll notice that its sensation changes a bit, and that's all good. And then I move down a bit, tiny bit more. Go back. And I can go all the way up my spine. By the time I get to my thoracic spine, around my shoulder blades, I'm gonna get a bit of a crack. That happens to me all the time. And it feels really good. Right there. Here we go. I just crack my spine. It's one of those things where if my elbow is in like this, it separates my shoulder blades, so it opens up the tissue, and it allows me to create more motion and opening of that area. I can even go sideways like this. I can even lift one side, other side, because these ribs, they rotate on your spine, so you want to create as many movement as possible, and that will be very helpful for the whole spinal column. We can even go to the neck, and this is called the suboccipital area, where the brain, the skull area comes towards the neck. So it's going to help with the spinal fluid. That helps supply blood to your brain and oxygen to the brain. I just turn to one side. I can even do circles there. It feels really good, right? A lot of time our skull is tight. You don't realize until you put the pressure on it, and then you realize how tight it is, and especially if your neck is tight on one side, you can feel more tension on one side of the head. Okay, so that's basically what I would do with this half a foam. Thank you.